Good morning, everyone, and welcome to the White House. I'm Dr. Howard Koh, the Assistant Secretary for Health for the U.S. Department of Health and Human Services. Thank you so much for joining us on this historic day to honor the 50th anniversary of the Surgeon General's report on smoking and health. To begin the program, it's my pleasure to introduce Cecilia Muñoz, Assistant to the President and Director of the Domestic Policy Council, the office which coordinates domestic policy making in the White House. Prior to this role, she served as Deputy Assistant to the President and Director of Intergovernmental Affairs at the White House. And before joining the Obama administration, Cecilia served as a community leader as Senior Vice President at the National Council of La Raza, the nation's largest Latino civil rights organization. Please join me in welcoming Cecilia Muñoz.
Thank you so much, Dr. Koch. Good morning, everybody.
Good morning.
I should start by welcoming you all to the White House. This is a great day, and we mark today the decades of public health research, policy, and community efforts that have dramatically reduced tobacco use in this country. The commitment of those of you in this room and your colleagues across the country to ending the tobacco epidemic is truly inspiring, and I'm just very proud to be here to acknowledge your accomplishments. And I want to be sure that you know how important this work is to this administration and to this president. Improving the nation's health is a goal of every president. It's a priority for this one. He has spearheaded legislation, taken executive actions, and used the bully pulpit to help make our children, parents, friends, families, communities as healthy and able to meet their potential as possible. That's why he led the effort to sign into law and implement the Affordable Care Act. The law is not only helping to improve health by making coverage more affordable, but it's improving access to tobacco cessation coverage for millions of Americans. That's why we made sure that the Affordable Care Act included new opportunities and new tools to support prevention and to help people to quit. We've made unprecedented investments in community prevention, including new campaigns that are reducing tobacco use, like the Tips from a Former Smoker initiative, which would not have been possible without the healthcare law. That also is why the President signed the Tobacco Control Act to give FDA new authority over tobacco products. And it's why we increased the cost of cigarettes and are proposing a new tobacco tax that will help both reduce smoking and support new investments in kids. But we know that there's a lot of work still ahead. And as you will hear today, far too many young people are smoking, and tobacco use remains the largest cause of preventable death in this country. So as we pause today to acknowledge how far we've come, let's also remember the lives lost too early due to tobacco and our shared commitment to protecting our kids so that their lives aren't cut short. We look forward to partnering with you and this work as we build a tobacco-free generation. So let me conclude by thanking you for the dedication and commitment to the health of our kids. And let me also thank the many public health leaders in the audience who have fought tirelessly for years to help improve public health and end the tobacco epidemic. And with that, it is my great pleasure and honor, really, to introduce the Secretary of Health and Human Services, a tireless advocate for the health of our children, Secretary Kathleen Sebelius. Madam Secretary.
Well, good morning, and thank you, Cecilia, not only for being here today and hosting this great event at the White House, but Cecilia, as head of the Domestic Policy Council, is overseeing this unprecedented coordination of work across government agencies on a whole variety of public health issues, none more important than what we're here today to talk about. So thank you for your leadership and your support. I want to start by extending a special word of welcome to the family of Dr. Luther Terry, our 9th Surgeon General, who 50 years ago began this effort to warn about the dangers of smoking and the link to public health. And we're joined today by members of the Terry family, and I'd like them to stand and be recognized. His sons, Michael and Luther, along with Luther's wife, Belinda, grandsons, Luther Terry and Luther Terry III, granddaughter, Agnes, and her fiance, Andrew. And just to tell you, Agnes recently graduated from the Harvard School of Public Health, so Dr. Terry's legacy continues not only here, but in the family. So welcome to the Terry family. I also want to welcome two of our former Surgeon Generals, Dr. Regina Benjamin and former Surgeon General Dr. David Satcher. So thank you. Can you stand and be recognized? Who played very important roles in pushing this effort forward. We also have Ambassador Michael Froman with us today. Ambassador Froman is our trade ambassador, and thank you for being here. Mitch Zeller, who heads up the anti-tobacco effort, I should say, at the Food and Drug Administration. Mitch is over here. And two very special HHS health leaders who are close advisors to me on a regular basis, but have worked on this issue for a very long time, who you won't have a chance to hear from today, but I want to make sure you know they're here. The Deputy Secretary of the Department of Health and Human Services, Bill Corr. And the General Counsel of the Department of Health and Human Services, Bill Schultz. And I can tell you the two bills make sure this item stays very focused in our department. You're going to have a chance to hear from Dr. Howard Koh, who's our Assistant Secretary of Health, from Dr. Tom Frieden, the head of the Centers for Disease Control and Prevention, and Dr. Boris Lushniak, who is the acting Surgeon General. But they, again, are incredibly involved leaders in this whole process. Now, we've made a lot of progress in the 50 years since the first Surgeon General's report on smoking and health. But we're still a country very much addicted to tobacco. And this addiction, this epidemic, has serious ramifications for our families, our communities, our overall health, and the health of our economy. So today, we're calling on all Americans to join in a sustained effort to make the next generation a tobacco-free generation. Our message to the American people is this: there are things that each of us can do in our own communities, in our own schools, our own businesses, that make actually a significant contribution to ending this epidemic, saving the lives of our loved ones, and making the next generation tobacco-free. Now, I invite you to think just for a moment about what the loss of one life means to a family, what that means to a neighborhood, what it means to a community. But year after year after year, tobacco use claims nearly 500,000 American lives. And across the world, tobacco kills 6 million of our fellow human beings every year. Now, those are more than just numbers. They're our parents, our colleagues, our friends, our neighbors, our global partners, and our children. Now, that's not to say we haven't made progress. Our tobacco control efforts over the past 5 decades have prevented, by some estimates, as many as 8 million deaths in this country alone. Our nation's smoking rate is half today what it was in 1964. But the fact of the matter is, even with this progress, tobacco use is still the leading cause of preventable death and disease, both in our country and across the world. If we look around the room, the likelihood is that all of us have been touched in some way by the loss of someone in our lives due to tobacco use. And one thing we know for sure: if we fail to act, we'll continue to lose the lives of people we love. Statistics tell us that most of the Americans who die from smoking this year began smoking when they were kids. And that every day we know that more than 3,000 children under the age of 18 try their first cigarette, and nearly 1,000 of those children become daily smokers. Now, if we fail to reverse those trends, 5.6 million American children who are alive today will die prematurely due to smoking. 5.6 million young Americans. Now, there are very serious economic consequences as well. You might have heard the recent report on NPR that looked at tobacco prevention control efforts in Oregon. For every pack of cigarettes that's smoked in their state, Oregonians pay an estimated $13 in lost productivity and medical expenses. Now just think about that for a minute. Every single pack, $13. And that's just one of our 50 states. As a country, the total economic costs of smoking now top $289 billion every year. Billion with a B, $1 billion every year. And I would argue, as Cecilia has already said, that no president has ever been as committed to ending the epidemic of tobacco-related deaths as is President Obama. Since the first days of this administration, 5 years ago, we have taken a very coordinated approach to help tobacco users stop smoking, to keep others from starting, and to use our regulatory authority to protect more consumers. In 2009, the President signed landmark legislation into law that gave the Food and Drug Administration the authority to regulate tobacco products for the first time. And many of you in this room were involved in that effort for decades and decades. Could you stand up and be recognized? Because 2009 marked a new one. Stand up, please. Stand up. Those of you, Howard, stand up. You were part of this. Tom, stand up. Now, because of this new law, the FDA has been able to implement a number of potential life-saving reforms already. Tobacco companies, for example, can no longer give free samples to get kids hooked, nor can they use bogus and misleading terms like light or low or mild as part of their marketing campaigns. Now, these reforms had languished in Washington for decades, but in 2009, President Obama was able to sign that bill into law. The following year, the President signed the Affordable Care Act, which has a number of key provisions. For example, it requires insurance companies to provide tobacco cessation services to their customers. It allows Medicaid beneficiaries to access tobacco cessation services at no out-of-pocket costs before they get sick, rather than afterwards. And the health care law also invests to support innovative and effective community-based projects across the country. Ringgold County, Iowa, for example, is getting support for their evidence-based tobacco control interventions, which are geared toward low-income rural populations. The Affordable Care Act also invests in public education campaigns that promote prevention and help people quit smoking. And as you heard Cecilia mention, one of these efforts is CDC's Tips from Former Smokers campaigns. If you haven't seen these ads, they are incredibly powerful. But here's what we know about them. Over the last couple of years, the campaign's graphic messages have helped convince 100,000 of our fellow Americans to permanently quit smoking, and to convince about 1.6 million more of our friends and neighbors to begin the process of trying to quit. They have a real impact on lives across this country. And research suggests that we're able to add as many as 500,000 years of life to the American population. That's a pretty significant campaign. We know that one of the single most effective things we can do to save lives is decrease smoking by increasing the cost of cigarettes. Therefore, as part of the 2009 Children's Health Insurance Program reauthorization, we brought the federal excise tax to $1.01 per pack. Now, this year's budget proposes to tack on an additional 94 cents, so we can discourage even more Americans from smoking, saving more lives and more resources. But this is a twofer. The additional revenues would allow us to provide universal early childhood education to 4-year-olds across this country, while strengthening health and education initiatives for infants and toddlers. So not only would we have the opportunity to save more lives by reducing tobacco use, and we know that use is particularly reduced in young smokers who are price sensitive, but we can also benefit the next generation by making the best single investment we can in their future at the beginning of a child's life. So ultimately, these actions will be most effective if they're paired with local efforts across our country. Over the past 50 years, we've been able to transform smoking from an accepted national pastime to an acknowledged health hazard. We've succeeded in driving smoking out of commercial airplanes and out of a growing number of restaurants, bars, college campuses, government buildings, and other workspaces. Now, with the lives of 5.6 million children in the balance, it's time to take these efforts to the next level. President Obama believes that a tobacco-free generation is well within our grasp. Dr. Lushniak believes a tobacco generation is well within our grasp, and I believe this as well. But what we know is this: the federal government can't do this alone. We have to have a very significant role to play, but it's not by any means the only role. We need an all-hands-on-deck approach to take tobacco out of the hands of America's youngest generation. We need the partnership of the business community, of local elected officials, of the academic community, the medical community, nonprofit organizations, the faith community, and of committed health advocate and citizens in communities across the country. We need more schools to follow the lead of colleges and universities, like the University of South Carolina, which has adopted a tobacco-free policy. Dr. Jean Luria, who is the university's Associate Vice President for Student Affairs and Academic Support, is with us. Jean, would you stand up or raise your hand? Thank you very much. We need the engagement of young people like Ryan Washington, a proud Gonzaga Eagle from Gonzaga College High School right here in DC. Ryan serves on the DC Youth Anti-Tobacco Coalition, and let's hear it for Ryan. Thank you very much. Across our country, individual Americans are taking critically important action. There's statewide efforts underway, like the bipartisan movement underway in Kentucky, the Bluegrass State, where Representative Sue Westrom is working across the aisle to make the Bluegrass State smoke-free. Now, Representative Westrom, thank you so much for your efforts. There's significant citywide efforts going on. One of the cities that's leading the way is the city of Chicago. And we're proud to be joined today by Chicago Commissioner of Public Health, Dr. Basharo Shukir. And thank you very much, Dr. Shukir. Would you stand up? And one of our great partners at the federal level is Assistant Secretary of Defense for Health Affairs, Dr. Jonathan Woodson. Now, Dr. Woodson is leading an effort across the military to stop smoking and tobacco use, and we can all agree that that deserves some applause. Thank you, Dr. Woodson. We're pleased that these local champions and statewide champions are here today because it's an example of the kind of very exciting work underway, but work we need to accelerate and continue. So today we meet at a crossroads. Over the past 5 decades, we've learned what it will take to end the tobacco epidemic and make the next generation tobacco-free. Scientists, researchers, and policymakers have already determined what works and what steps are necessary to end this tragic epidemic. And the question is really, what kind of a country do we want to leave our children and grandchildren? Because when I think of where we can be, I see a country where smoking is no longer considered in vogue for young people. I see a future where our kids are not burning through hundreds of billions of dollars each year as an economy due to tobacco use. A future where millions of moms and dads and sons and daughters and nieces and nephews aren't lost before their time. Now, I can tell you that's a future that this president, President Obama, sees as well. And it's a future within our grasp if we're willing to work together to make it so. Again, thank you all very much for what you've done so far, but roll up your sleeves. We have just begun. Thank you. And Dr. Koh, I think Dr. Koh is coming back to the podium.
Thank you so much, Madam Secretary, for your strong words and your leadership, and welcome again, everyone, to this very special occasion at the White House. This day is a historic moment for reflection, recognition, and resolve. First, we recognize the national leaders who have passionately advanced tobacco control to make our country healthier. Thank you. We have so many examples of your dedication. Academic experts who have propelled the science. Heads of voluntary organizations and community coalitions who have served as crucial leaders for change. And legal experts who have challenged the tobacco industry in the courts. Today, we begin by recognizing these visionaries. Because of you, tremendous progress has been made. But 50 years after the landmark Surgeon General's report, the tobacco epidemic still rages on in every community and every corner of our country. Far too many are still becoming hooked and dying well before their time. Millions continue to suffer preventable suffering and die preventable death. Lung cancer, which should be an uncommon illness, instead still remains the leading cause of cancer death. And projections are that the typical smoker loses at least a decade of precious life. So 50 years later, tobacco addiction remains a public health catastrophe. To summarize, our good health is a precious and fragile gift, and tobacco takes that gift away. This is not an accident. These deaths do not occur just by chance. Each year, the tobacco industry spends $8 billion, nearly $1 million an hour, to advertise and market cigarettes and smokeless tobacco, thereby outspending current state tobacco control programs by a factor of 18 to 1. Each year, the tobacco industry recruits customers to consume over 14 billion packs of cigarettes, with each cigarette now understood to be a finely engineered and exquisitely designed nicotine delivery device. And each year, the tobacco industry adds to an ever-growing array of novel products like flavored small cigars that have special appeal to young people. For too long, these efforts have succeeded in creating a society where tobacco use is the social norm, thereby leading to devastating consequences. And as a result, for each adult dying from tobacco, 2 younger replacement smokers have been recruited to take their place. And in this tragic way, the cycle of dependence and death continues for yet another generation. This is unacceptable and intolerable, especially since the burden of tobacco now falls disproportionately on some of our most vulnerable, such as persons of lower socioeconomic status, sexual minorities, and those living with mental illness and substance use disorders. As a nation, we should not be forced to accept the unacceptable and tolerate the intolerable. Today, our nation is at a crossroads. How will we address the tobacco epidemic for the future? Our collective answer must be that we renew our resolve and redouble our efforts for prevention. One of our biggest societal challenges now is the misperception that somehow this epidemic has already been solved when nothing could be further from the truth. We cannot somehow assume that this battle has been won when our toughest challenges still lay ahead. It is time to commit to ending the tobacco epidemic once and for all, and it shouldn't take another 50 years. We have at our fingertips many tools to solve the epidemic. We know what works. In 2010, the U.S. Department of Health and Human Services released its first ever strategic plan for tobacco control. This action plan provides the critical framework to rejuvenate and reinvigorate national efforts to end the epidemic. Now, today's Surgeon General's report underscores the essential commitments initially outlined in that action plan. And they include high-impact mass media campaigns and increased efforts to prevent kids from being bombarded by images of smoking in the movies. Fully funded, comprehensive statewide tobacco control programs at CDC recommended levels. Higher prices on cigarettes and other tobacco products that will drive down consumption. Complete protection of the entire population, not just half the population, through smoke-free indoor air policies. Effective implementation of FDA's tobacco product regulation authorities. Full access to cessation counseling and FDA-approved medication for smokers. And this list is just a start. Most important of all, we need committed leadership through every sector of society. Leadership that will reject the status quo as acceptable and move our nation to a healthier future. It is time to reclaim the social norm as one that is tobacco-free and bring health, not disease, to future generations. Because we will be successful if everyone commits to ending the suffering and making this epidemic a thing of the past. It is our hope, with a renewed sense of urgency, starting today, that we can someday relegate the tobacco epidemic to the history books, just as we have done with smallpox. Let's commit to ending this epidemic once and for all and give our kids a fighting chance for our healthy future. Thank you very, very much. And now it's my great pleasure to introduce my colleague, the Acting Surgeon General and Rear Admiral of the U.S. Public Health Service, Dr. Boris Lushniak.
Thank you, Dr. Cohen. Good morning to everyone. Being a young tot in the Ukrainian neighborhood of Chicago, I have no recollection of the landmark public health earthquake brought on by Surgeon General Luther Terry's report 50 years ago. But as a young and eager commissioned officer of the United States Public Health Service stationed at NIOSH in Cincinnati, CDC NIOSH in Cincinnati, I remember the pride of being a member of COOP's troops as we recognized 25 years of progress in reducing the health consequences of smoking. I would never have imagined then that I would be here now. As Acting Surgeon General and a career officer in the U.S. Public Health Service, where we live by the mission, protecting, promoting, and advancing the health and safety of our nation, I am proud and humbled to be here, to release the 32nd Surgeon General's report on smoking and health, 50 years after Dr. Luther Terry released the first groundbreaking report. Today marks a new era in the fight against tobacco-related death and disease. Under the revitalized mantra that actually C. Everett Koop used 25 years ago, enough is enough, we, the public health community, and all of our partners, rededicate ourselves to new goals pointing us in the same direction. 12% smoking rates in 2020, 10% in 10 years, or a smoke-free generation in a generation. The 50th anniversary report is the result of over 5 years of hard work by 85 contributing authors and 120 expert reviewers. What an undertaking. In particular, I'd like to ask the report's editors to stand and be acknowledged for their outstanding contributions. And that's Dr. Jonathan Samet, Dr. Terry Pahacek, and Leslie Norman. Also, at this time, I'd like to recognize my Surgeon General colleagues, as already done, the 16th Surgeon General of the United States, Dr. David Satcher, the 18th Surgeon General, Dr. Regina Benjamin, my colleague from the Navy, Surgeon General Vice Admiral Matthew Nathan, two former acting Surgeon Generals of the Commissioned Corps of the U.S. Public Health Service, Rear Admirals Ken Moritsugu and Stephen Galson. In addition, I'd like to acknowledge the many flag and general officers of our sister services and the U.S. Public Health Service, and greetings to all those who serve our nation in uniform. When the first Surgeon General's report on smoking and health came out in 1964, few people understood or anticipated the enormity of the effect it would have on a nation's health. On January 11, 1964, the 9th Surgeon General, Rear Admiral Luther Terry, issued a message which was really simple, but so definitive. It was unequivocal and unapologetic. What it said was, cigarette smoking is a health hazard of sufficient importance in the United States to warrant appropriate remedial action. And that set us off on a path. It set us off on a battle. Since then, our knowledge of the health consequences of smoking and involuntary exposure to tobacco smoke has expanded dramatically. The conclusions from Surgeon General reports have evolved from a few causal relationships in 1964 to a robust body of evidence documenting the health consequences of both active smoking and exposure to secondhand smoke across a range of diseases. Over time, both the number and strength of our conclusions on the impact of smoking have increased. So this morning, I summarize for you the 10 major conclusions from the anniversary report entitled The Health Consequences of Smoking, 50 Years of Progress. 1. Since the first Surgeon General's report in 1964, over 20 million premature deaths can be attributed to cigarette smoking. Today, the annual death toll from smoking is approaching 500,000 per year. Enough is enough. 2, the tobacco epidemic was initiated and has been sustained by the aggressive strategies of the tobacco industry, which deliberately misled the public on the risks of smoking cigarettes. In the US alone, tobacco companies spend nearly $1 million an hour, 24/7, to market their deadly and addictive products. Enough is enough. 3, since the 1964 report, cigarette smoking has been determined to cause diseases in nearly all organs of the body, to damage overall health status, and to harm a growing fetus. The science has revealed in stark clarity that common diseases such as diabetes mellitus, rheumatoid arthritis, and colon and rectal cancer are also caused by smoking. Enough is enough. 4, exposure to secondhand smoke causes cancer, respiratory, and cardiovascular diseases and adversely affects the health of infants and children. Enough is enough. 5, the disease risks from smoking by women have risen sharply over the last 50 years, and women are now as likely to die from smoking as men. Enough is enough. 6, cigarette smoking causes inflammation and impaired immune function, reducing the body's ability to fight off infection and disease. Enough is enough. 7, although cigarette smoking has declined significantly since 1964, very large disparities in tobacco use remain across groups defined by race, ethnicity, educational level, and socioeconomic status, and across regions of our nation. Enough is enough. 8, comprehensive tobacco control programs and policies are effective. However, we need to use them across the nation if we are fully to benefit from their success. Further gains can be made with the full, forceful, and sustained use of these measures. We must fund these programs at CDC recommended levels. Enough is enough. 9, the burden of death and disease from tobacco use in the United States is overwhelmingly caused by cigarettes and other combusted tobacco products. Rapid elimination of their use will dramatically reduce the burden. Enough is enough. And 10, the final one. For 50 years, a half century, the Surgeon General's reports on smoking and health have provided a critical scientific foundation for public health action directed at reducing tobacco use and preventing tobacco-related disease and premature death. We pray that the 75th anniversary report will have many zeros, and that the 100th anniversary will be marked by grainy pictures from the past. Enough is enough. I'd like to spend just a few minutes going through some of these newly identified health consequences of smoking found in this report. It's astonishing that so many years later, we're still making these new findings. Today, we know that smoking is a cause of diabetes, rheumatoid arthritis, and poor response to treatment of arthritis, erectile dysfunction, an increased risk of tuberculosis, disease, and death. We're adding colon, rectal, and liver cancer to the long list of cancers caused by smoking. And stroke is now a known consequence of secondhand smoke exposure, new material. One of the most disturbing findings is that the disease risk from smoking by women have risen sharply over the last 50 years. Women are now as likely to die from smoking as men. Women smokers' risk of lung cancer is now the same as men. And more women die from chronic lung disease than men. The news for mothers and babies is also sobering. Smoking can cause potentially fatal ectopic pregnancy and reduce fertility. And for the children of women who smoke during pregnancy, smoking causes cleft lip, cleft palate. Smoking may attribute to behavioral disorders such as ADHD, and smoking can have lasting adverse consequences for brain development. Other diseases caused by smoking include macular degeneration, a cause of blindness. Smoking is now known to cause 13 different cancers. In 1964, we could only be sure about one cancer, lung cancer in men. Today, we know that smokers have a greater risk of developing lung cancer than did smokers in 1964, even though they smoke fewer cigarettes. Changes in how cigarettes are made and the chemicals they contain have increased the risk of the most common form of lung cancer. Cancer patients and survivors who smoke have a higher risk of dying from cancer and other diseases, including breast and prostate cancer, than patients who don't smoke. We're still examining why this is the case, but the evidence suggests that smoking results in poorer response to treatment, increased risk of recurrence, and increased treatment-related toxicities. The need for more rapid action to reduce smoking and tobacco use in the country is further emphasized by our new findings on the economic burden caused by smoking. As you heard from the Secretary, the annual cost to the nation is approaching $300 billion each year. These costs, plus smoking attributable disease and death in our population, will continue for decades unless the prevalence of smoking is reduced more rapidly than the current status quo projections. The burden of tobacco is not shared equally. Our education, income, race, where we live, especially the Midwest and Southeast, our sexual orientation, and whether we have mental illness, these factors affect whether we are harder hit by tobacco. The report also concludes that the root cause of this smoking epidemic is the tobacco industry's aggressive marketing and promotion of deadly and addictive products. The last century has taught us that public health leadership is essential in effectively dealing with aggressive tactics of the tobacco industry. We need to achieve more rapid progress in helping the 45 million plus smokers in this country, including 3 million youth who smoke, to quit completely. For those smokers, the clock is ticking. They can't wait for slow and steady progress to end the tobacco use epidemic. That's why we must strengthen our resolve and undertake the strategies that Dr. Koh discussed, and potentially introduce new strategies to more quickly end combustible tobacco use. We can't wait another 50 years. So I've summarized here some of the key findings in today's report. It's a good read, although I have to acknowledge that at 980 pages, the report is really geared to a scientific audience. But it's absolutely critical that all Americans understand the report's findings and their recommendations. If we're going to work together to achieve a society free of tobacco-related disease, this must be understood. So today, you'll also find in your packet an executive summary, a readable executive summary of this report. I'm encouraging you to read this, but if you don't have the time, read the truncated version. There also is a consumer guide that translates the findings into plain English. The guide is also now available, as of midnight last night, on our website, surgeongeneral.gov. The 50th anniversary should strengthen our resolve to end the tobacco epidemic once and for all. Today, we are also launching a public service announcement to remind us that the status quo is very unacceptable. I'd like to play it for you now.
In the past 50 years, we've made a lot of progress in smoking prevention. But if we don't do more, 1 out of every 13 children alive today will die early from smoking. That's 5.6 million precious lives we can save. Together, we can make the next generation tobacco-free.
So it's all about prevention. It's all about activism. It's all about moving ahead. It's all about getting more aggressive than we have been. As chair of the National Prevention Council, I'm proud of the federal government's leadership to address tobacco use, the most common cause of preventable disease and death in this country. The National Prevention Council brings together 20 federal departments and agencies to provide leadership and coordination related to health, prevention, and wellness. And our council members have made a strong commitment to promoting cessation and expanding tobacco-free environments. I'd like to thank the many council members and advisory committee members who are attending today in person or on the webcast. As also mentioned earlier by Secretary Sebelius, we have the pleasure to have many of Dr. Luther Terry's family with us today. Earlier this morning, I had the pleasure to present the members of Dr. Luther Terry's family who are with us today with the Surgeon General's medallion. The citation on the medallion reads, "In recognition of the 9th Surgeon General, Dr. Luther Terry, a pioneer in the 50-year battle against tobacco, 1964 to 2014. We congratulate all of you on this incredible legacy in this battle to create a world without smoking. Many people have played critical roles in this 50th anniversary Surgeon General's report, but I'd like to especially thank the staff of CDC, OASH, and my own staff in the Office of the Surgeon General for your commitment to this endeavor. A special shout out to Dr. Mary Beth Bigley, who for 7 years has carried the torch on Surgeon General reports, calls to action, and our own journal, the Public Health Reports. She'll soon be leaving the Office of the Surgeon General and taking on new adventures at HRSA. We look back with admiration and gratitude to Dr. Luther Terry and many other individuals who started us on this path of progress. Today we call upon all Americans to continue to work to advance this bold and noble cause. As Americans, we know we can achieve great things when we dedicate ourselves to a mission. In particular, we assign a tasking to the next generation, represented here by Ryan, stand up Ryan, by Lukey, stand up Lukey, by Larissa, stand up Larissa, and by Stephanie. And I ask this next generation to make a pledge to be partners in making your generation tobacco-free. You have been told, go forth and prosper. The mission to achieve, you may be seated, to achieve a tobacco-free, healthy, and fit society, to be able to flourish in the 21st century is achievable. Without our health, life, liberty, and the pursuit of happiness as unalienable rights remain elusive. Enough is enough. Thank you. I'd like to turn the microphone over to a great friend, a fellow public health leader, a mentor of mine, a fellow EIS alum, Dr. Tom Frieden, the head of the Centers for Disease Control and Prevention.
It's a little humbling to give a talk after someone has just said enough is enough. But it's particularly humbling to give such a talk with so many people in the room who've worked so hard, so creatively, in such a dedicated way to stop the epidemic of suffering, disease, disability, and death caused by tobacco. So I really want to thank all of you for the wonderful work that you have done for so many years. We are all standing on the shoulders of Luther Terry, of the people who worked on that report, of the people who've been working in tobacco control for decades, and we know that there's been tremendous progress. But we know also that there have been far too many lives lost. And I will say that the first big finding of this report is that we know that amazingly, 50 years in, we're still finding out new ways that tobacco maims and kills people. And it's not only figurative that this is a lot larger than this, but we know so much more about how tobacco is killing people. 20 million people killed, including 2.5 million people killed by secondhand smoke and 100,000 babies killed by exposure to tobacco smoke. So I think the first big conclusion is that tobacco is even worse than we knew it was. The second is that tobacco control works. When we implement programs that work, which many of you have been essential in trying, finding, and implementing, we can save millions of lives, at least 8 million lives saved in this country in this period, and more to come. We know that about a third of all of the increase in life expectancy in this country was from cessation of tobacco use. About 2 years out of the 6.6 years gained in the U.S. as a whole, not just for smokers, the U.S. as a whole, almost a third of our life expectancy increase from this one tremendously successful public health program of tobacco control. But we also know that we're not doing nearly all that we should and could do to help smokers quit and to prevent kids from starting and to protect people from secondhand smoke. As a physician, I can tell you that the most difficult thing we do is to tell someone that they have a terrible disease that may kill them, make them sick, cause pain and disability and disfigurement, and that it could have been prevented. So many patients will say to us, as they have said to me, I just wish I had known. I wish I hadn't smoked. And part of what we're trying to do is to collapse that time horizon so that we don't have that regret, so that we don't lose those cherished members of our community. But we also know as physicians how hard it is to quit smoking. We know how addictive tobacco is, and the previous Surgeon General report documented that in great detail. But we also know that most Americans who've ever smoked have already quit. We know that most Americans who smoke today want to quit. We know that most Americans who smoke today try to quit each year. And we also know that in communities around the country where effective policies are in place, not only do they work, but they work astonishingly well. So that the rate of smoking among kids, for example, in some of the cities in the US is less than half of the national average, down in the single digits, around 8%. We can stop this tragedy. For many years, CDC has had recommendations for what should be spent, and you've heard a lot of figures here. I just want to give 4 at this point, just 4 more. The first is that the states and localities around the country collect $80 billion, that's with a B, $80 billion a year in master settlement agreement and tobacco taxes. The tobacco industry spends $28 billion a year on marketing and promotion. We at CDC recommend that states spend at least I've said those numbers wrong. Sorry. Let me get that back. The tobacco industry actually spends about $9 billion a year. That comes out to $80 per person per year. Sorry, I'm getting it wrong again. Let me start that again. 4 numbers. I'll try to get these right. The first is the amount that is collected in tobacco taxes, and that comes out to $80 per person per year. around the country. So $80 per person per year from both master settlement agreement and tobacco taxes going to state governments. The second number is the amount that the tobacco industry spends on marketing, sponsorship, and promotion, and that number is $28 per person per year, every man, woman, and child in this country. The third number is what we at CDC recommend states spend on tobacco control. That's $12 per person per year. Not a lot to ask to address what is the leading preventable cause of death in this country, and it's costing our country close to $300 billion a year. But the fourth number is the saddest. It's what states actually spend on tobacco control, and it's less than $1.50 per person per year. So we're not implementing the things that work. We know that it's a terrible problem, even worse than we knew. We know that programs to stop it work, but sadly we're not doing them to the extent that we would like to. Now, one bright spot has been the Tips from Former Smokers campaign and the work publicizing and sharing stories of individuals who have come forward and said, we want others not to say, I wish I hadn't done this. We want others to be protected by what we have gone through. And I've had the privilege to meet several of these individuals, and I think particularly of Terry Hall. Terry started smoking as a teenager, as most smokers do. She smoked for a long time. Her smoking caused throat and oral cancer, and she didn't shy away from sharing her story. In fact, she wanted to make sure that as many people were aware of what smoking had done to her as possible. And Terry's ads on the Tips from Former Smoker campaign attracted more than 2 million YouTube views. She was greeted in supermarkets and the public by people who came up to her crying and saying, you saved my life. Terry's story is known to millions, and I had the great privilege of getting to know Terry and work with her on some of the media outreach and some of the filming, some of the community outreach here. Sadly, last September, we lost Terry. The world lost Terry, and her family lost Terry. She died at the age of 53 from smoking. As she died, she actually insisted that we come to her bedside and film one more set of ads so that she could help even more people not be killed by tobacco. Another individual, Nathan Muñoz, was also a victim of smoking, although he never smoked. Like, he was one of those 2.5 million people killed by tobacco, although they never smoked. He worked for 11 years in a casino that allowed smoking, and secondhand smoke permanently damaged his lungs. He worked to improve health in his community and for all Americans, and unfortunately, he also died last year at the age of 54. Both of these individuals participated in the Tips from Former Smokers campaign. That campaign has saved tens of thousands of lives and prevented hundreds of millions of dollars in health care costs. Quitting can be hard, but I'll end with one message for everyone who smokes. Quitting is hard, but it is the single most important thing you can do to improve your health. Most Americans who've ever smoked have already quit. Most people who smoke today want to quit. You can quit. Get help if you need it. One way or another, you can get tobacco-free, and together we can indeed put an end to the epidemic of disease, disability, disfigurement, and death caused by tobacco. Thank you all very much.
I want to ask Dr. Samet to please join us here on stage, and we have some time for questions. This ends the sort of the formal part of our presentations. We hope you walked away with some information, some numbers that you didn't walk away saying enough is enough, I'm out of here. But in this case, we have several people in the room with their microphones. If you would like to ask a question, raise your hand. We'll make sure you get a microphone to you. And if you could identify yourselves, if you so desire.
Good morning. Okay. Can you hear me? Yes. All right. I'm Damani Jefferson. I'm with the National African American Tobacco Prevention Network. And this report seems outstanding. I was just reading through the executive summary. And I see there that you're talking about the tobacco end game. At the last Surgeon General's report, there was a wealth of evidence suggesting that mentholated tobacco products led to the initiation of tobacco use by young people, but it failed shy of actually recommending the banning of mentholated tobacco products. And so as we talk about the end game, I see that they talk about the ability for tobacco product regulation to have an impact on public health. Are we thinking about banning menthol being included in that in terms of trying to end the tobacco epidemic?
So I can address that. We have first of all, thank you for raising that issue, which is a key public health issue, and we have a very thorough process being overseen by the FDA right now. First, their scientific advisory committee looked at all the evidence and the science, and actually that committee was chaired by Dr. Samet. That report was put together and released. The FDA did their own internal scientific report as well. And then last summer, they put out an advance notice of proposed rulemaking to invite public comment about potential options for regulation. So those options are now being very carefully reviewed by the FDA. We want to thank them for their thoroughness in doing it on a scientific basis, and we expect to hear some outcomes in the near future.
Good morning. Paul Billings, American Lung Association. Thank you very much for your leadership today. Enough is enough. The American Lung Association is very thankful for the efforts under the Affordable Care Act to increase access to tobacco cessation for smokers. But we've heard and seen confusion from states and insurance providers about what exactly is a comprehensive tobacco cessation benefit. Will the administration making efforts to define this critical provision of the Affordable Care Act so everyone knows what a comprehensive benefit is and what is required in order to comply with the Affordable Care Act, and most importantly, give those smokers the help they need to quit?
Well, we are very proud of the Affordable Care Act for many reasons, but one is its major emphasis on creating systems of prevention and public health. And the access to preventive services is a major theme that applies not just to tobacco, but to HIV and to obesity and so many other themes. So your point is a good one in that there's a broad opportunity for millions of people to get preventive services without added cost on private plans. But exactly how that's being translated state to state has differed till now. You have to remember we're still in the very early phases of the health reform chapter of our history. This is the first full year of implementation. So we are working closely with many colleagues like yourself to define that further, to drill down on it, and to really give people the prevention benefits they need and deserve. So thank you. We're going to continue to work with you on that.
I'm Carol Pearson with the Voice of America. And if enough is enough, and the FDA has the power and the ability to regulate tobacco products, is there any thought to becoming even more aggressive and banning tobacco products, which would end the tobacco epidemic?
You know, the issue, I mean, fact is fact, right? Cigarettes cause addiction, cigarettes cause disease, cigarettes cause death. The question of banning, of course, is sort of a bigger societal issue. I think the emphasis at this point is we need to have that discussion. We really do. But until we do have that discussion, the reality of the situation is we need to use the tobacco control tools that we currently have available, the ones already cited, and ramp up. Because at the end of the day, if we are shooting for that tobacco-free generation, it is attainable using the tools that we have. But without a doubt, I think we need to have that discussion.
We have time for one last question.
John Klein, American Academy of Pediatrics, thank you very much for a very excellent report and for this new commitment. I think we are also extremely concerned about the marketing and addiction of youth and are dedicated to eliminating tobacco, secondhand smoke, and nicotine addiction from all of our children, youth, and protecting non-smokers. And we're very concerned, and I think you have evidence in this report on the marketing, very concerned that too many of our advocates against tobacco are entertaining the debate about what harm reduction could or couldn't do and whether evidence is needed to demonstrate whether new tobacco products are in fact reduced harm or not, when, until we've regulated them adequately from a marketing perspective and a nicotine addiction perspective, we are losing the next generation, and we're losing the public opportunity to act. And so I hope that all of us will recognize that unless we've regulated and controlled the marketing to young people that's going on among flavored products and new nicotine delivery devices, that we ought not to be leading that discussion with whether they have a role in public health or not.
I take that as a comment, not so much as a question, but is there any feedback from the group here? Okay, great. I see Dr. Frieden's eagerly grabbing for the microphone, so.
So I do think that one of the things that's so horrifying about this report is that 5.6 million kids alive today will be killed by tobacco unless we take urgent action. And the report actually breaks that down by state. So you can see state by state how many deaths there will be unless we act now. I think, as Dr. Lushniak says, we need to do two things. The first is to fully implement the things that we know work. WHO has summarized that in the Empower package. You've heard about them this morning. I won't repeat them, but there are clear things we know will make dramatic differences, and already in many cities and communities have made dramatic differences, driving rates of smoking in kids way down. We also have to think about what the future may hold. And if we're talking about tobacco products, I would say, as you have said, essentially, they are guilty until proven innocent, not the other way around. We need to know that they will not be harm to children. We need to know that they will not keep people smoking rather than help people quit. And all of these new products may have a positive role if appropriately regulated, but not in the way that they're being sold now with widespread marketing over the internet, with bubblegum and cotton candy flavors, with free samples, with nearly 2 million American kids having used e-cigarettes. So we clearly need to support the FDA. They're going to face undoubtedly legal challenge, as they always do. So they have to win that careful balance between regulation that's effective and regulation that's going to stand up in court. And at the same time, we always have to be innovating. We always have to be willing to try new things. If people in this room hadn't tried new things, we wouldn't know that smoke-free air acts save lives and don't hurt business. We wouldn't know how effective tax rates are at reducing smoking, especially in kids. We wouldn't know how effective ads are at reducing smoking if they're well designed and implemented. So innovation is an essential thing for us to continue as we implement our current strategies and as we find new ones to prevent those 5.6 million deaths.
Great. I think that sort of ends our time span for formal questions in front of the group. I know several of us will be circulating amongst the audience, and so if you have follow-up questions or anything else you want us to clarify. But I thank you first and foremost for being at this historic event. I keep telling people that the 50th anniversary only happens every 50 years, and so thank you so much.